I went into med school with an interest in surgery, but I quickly discovered that what I liked was the variety that family practice had to offer and the opportunity to follow patients and develop long-term relationships with them over the course of my career. People don't live in isolation. They live in the context of their family, and the dynamics and the events that are going on impact their health. North Burnaby is a very stable, family-oriented community, and people have been living here for 50 or 60 years. And so I have 3 generations of families in my practice and cousins and in-laws, and I get the opportunity to take care of the whole family. So it really makes it feel like true family practice. Burnaby is a city, but it has a community feel. We have one hospital, we have a more limited number of specialists, so you can really get to know the specialists and your colleagues that you work with. At the same time, it's amongst bigger cities, and so you have all the resources that a bigger city has to offer. My dad's a dentist in North Burnaby, and when I started locuming in North Burnaby, I discovered I was seeing a lot of patients that had been seeing him for 20 or 30 years. It may have influenced my decision to join a practice in North Burnaby because it gives that community feel that Burnaby has. In my current practice, I have a lot of patients who've been seeing him for many years, and they find it neat to have one family caring for their own family. But it does create some confusion sometimes when they think their dentist's office is calling them about their blood test results. You can tailor your practice however you like. There's a wide demographics of age from young families to seniors. I joined the board of the Burnaby Division of Family Practice a couple years after settling into Burnaby, and it really helped me get to know the other physicians in Burnaby and become part of that community of GPs. One of the great things about the Burnaby Division of Family Practice is its focus on the physician. It's easy when you're practicing in your solo practice or your small group practice to feel isolated, and the division holds events that brings all the GPs together, and it builds that community of GPs, that collegiality that is so important to feeling like you're part of a community as a physician. One of the events that the division recently put on was about the Provincial Family Practice Toolkit, which is a set of resources outlining the business side of medicine, of how to run your office. Things like staffing, human resources, policies, employee standards, everything you don't learn in medical school and residency, yet you get out in practice and suddenly you're supposed to know how to do. Having that resource and learning about it, talking with other physicians about what they do in their office was really helpful to help know how to optimize my practice and work more efficiently. Burnaby's a really easy community to work in and control your own work-life balance. You can work where you want, when you want, how much you want, and find that work-life balance that works for you. In my spare time, I ski in the winter, and Whistler is just within a 2-hour drive away. I like road cycling, I play tennis. The climate in the Lower Mainland makes it easy to be active all year round. I actually live in Vancouver. I grew up there, my family's there, my roots are there, but living in Vancouver and working in Burnaby couldn't be any easier. It's a short drive against traffic to work in the morning. I can bike to work in the summer, and Burnaby's very centrally located, so you can work in Burnaby and live anywhere.